is Sunday night, and you know what that means. It's Sunday night service, and I'm Danny Williamson with Integrative Family Medicine, and this is Chelsea Madison with the Breathe Well Group. And tonight we are talking all things myofunctional, which she's going to tell us what that means, by the way. Myofunctional disorders, things like tongue ties, cheek ties. Who knew? I didn't know. Lactation issues, and all the things associated with dysfunction in the oral cavity, right? I mean, it's
Yep.
fascinating, Chelsea. I can't wait to hear about this. And she's local here in Middle Tennessee. So as soon as you all get on, I need you to hit your heart buttons, hit your like buttons, tell us where you're from, share it with your people for sure, and then ask your questions, because this is a very niche subject here, and I guarantee you so many people, more than we know. Do you know a percentage, Chelsea, of people, of babies that are tongue tied?
I don't
Because I
know.
don't.
I think that would be amazing to have that information.
Yes,
I have to do, a worldwide study on that. Of course, a huge percentage of the people I see have it, but I only see people when they have problems. So
absolutely. Well, tell us, Chelsea, welcome to Sunday night service. And guys, as you all know, this is very casual, and we're just gonna I'll tell you a tiny bit about her, then I'm going to let her take it over. But she got into this from, was it your firstborn
yeah,
child or no?
firstborn. Yep.
And how long ago was that?
He's 8.5 now.
Okay. And he was a tongue tied baby. I'm assuming he wasn't latching on well. I don't know. Okay. And this is how she got started. And like me, she had a mentor. She was working in a dental office, and Dr. Prather was who she was working for, and she had a mentor who taught her a lot about this apparently and encouraged her. And in September of 2020, she stepped out on her own with her own group, and I can't wait for her to tell you about all of this. So Chelsea, take it away. Tell us all about what you do and how you got started.
Yeah. Hey, everybody. Thanks for being here. I'm super excited to be with you guys and just hanging out on this Sunday night. So, my first degree is I'm a registered dental hygienist. That's how I got to work with Dr. Prather. We are just doing all the regular dental stuff. We have our oldest, both of them are about the same age. So, we had them around the same time. So, went through the similar nursing issues together. As a lot of people know, this is just not something that is taught in any traditional program. So it doesn't matter what level of training your doctor has or whatever it could be, unless they have specialty training, this is just not something that is taught in any curriculum. It doesn't matter where it is across the board. So in seeking lactation help and asking pediatrician and this and that and all of the different things that we go through, the only answers that I could get, or even that she could get, was just, oh, it's fine. The bleeding nipples is fine. The baby screaming is fine. It's okay if you can't transfer, we'll just go to formula or bottles, or we'll just pump forever. All the traditional things that you hear. And it was so disheartening. And I could just feel that that was not right, because there weren't pumps a long time ago. What do we do if there weren't pumps? There wasn't formula, there wasn't bottles. There's no way that that was the correct way that we should be handling this. And I'm the type of person that when I see something is just not adding up, I will investigate until I can figure out what's going on. So Dr. Prather and I kind of went on this journey together. Obviously, she does the surgical aspect of it. And I started doing the muscular aspect of it, because they have to be paired together. So as we were learning, growing, all of the things that were happening, I got really, really passionate about the infant population. So just a little bit of background with a hygienist who can treat infants. There, you kind of have to go back doorway, like an SLP. If they have feeding therapy hours and they are a feeding therapist, they automatically can treat a certain population. For us as RDH, we only have a certain population that we can treat unless we go through lactation training. So I also am a lactation consultant, and I'm sitting for my IBCLC board next time that it comes up.
Good for you, girl.
I'm super excited and nervous about that. So I had to just do a lot of additional training. The hours that I have in training for lactation, myofunctional therapy, infant oral motor, cranial nerve dysfunction. I'm doing a course for CFT next month. I'm also doing an online course right now for reflex integration. Not so that I will do that, but so that I can identify and make sure that we are referring appropriately, because I think that's another big missing piece that we have. I have probably almost doctorate amount of hours under my belt. It is just so much training that you have to go through when you're going the back doorway. But I was not willing to go back to a traditional school because I knew that that was not the training I needed and wanted. I
That's
wanted
right.
to seek out the specialty training that I needed, no matter how long it took me to do. So, 7 years, almost 8 years into this journey for me, I'm still doing training, and I probably will continue forever, because with bodies, everything changes. The stuff I learned 7 years ago is different from what I'm learning now. So that is
You're still talking. That was me. Sorry. User error. Go
that is
ahead.
super important when you're choosing your provider. There's lots of people that claim that they can do myofunctional therapy, or they do this, or they do that. And then what happens is that they don't get the results that a lot of the other larger groups are getting, or they're not actually getting the specialty myofunctional therapy that they're needing, or infant oral motor, or whatever it could be. It's really important that you're searching through your group's qualifications,
Right.
even if that means that just the leader of the group is the one that has most of it. Lucky for all of the employees that work with them, but they get all of the training in their own personal courses from that owner. And that's kind of how I run my practice is, we start off with training a certain way. And then say for lactation, I have an IBCLC that works for me, and she is trained in infant oral motor, so she can run those appointments too. Well, she got all of my knowledge from the last 7 years of doing this compiled into one internship that she did with me. And now she's able to do everything that I do, and she has everything that's in my brain, basically. And same for the older population. I do everything pretty much the same. I invest so much in my group so that everybody that we see can get really high level care.
Wait, hang on a second. What do you mean the older population? What's older? Are you talking
So
a
I mean,
6-month-old
okay,
baby, or are
so
you
that's a
talking about
great,
a
that's
15-year-old
a
kid?
fantastic question. So my heart is with the 2 years and under. That is what I really like to treat. It's what I'm really, really good at, especially infants. That is where I thrive, and I know that. And so that's where I like to stay. So older in our group population is the 4 and above. So not even old, but that is older when it comes to finding and treating myofunctional disorders. Ideally, we would identify these issues at birth. And even if
Yes.
we're not having tongue tie releases, or even if we're not having whatever it is going on, because I have all kinds of people that come into our practice, and it is not my goal to judge or force anybody's hand when they're making decisions. I give them the information, I guide them the best that I can. And I still do all of the muscle work. So either way, whether they decide to do the surgical aspect or not, they're developing the muscles, and they're developing their jaws and the bones, the hard tissue and the soft tissue in the mouth. And then we do releases whenever that family is ready, if they are ever ready to do that.
Wow. It's interesting. I had a lady in the store, in the supplement store this week, and she said that I could think it was her grandson. I can't remember. It wasn't her child, granddaughter, grandson was tongue tied. Pediatrician refused to do anything, said, nah, it's fine. He'll outgrow it. This is what they told her, this mother. And it was a bloody nightmare. And it really was, because the child was older before they ended up getting the tongue,
Yeah.
clipped. So do you see that a lot, that it's missed, or they say it's no big deal?
Yeah. Yeah. Unfortunately, I see it way more than I should. And there have been so many times that I'm doing a consultation in the office, and I have an older child that, they have all of these speech issues or these severe sleep issues, or they've developed very poorly because of their muscle function and or ties. And a lot of it really just could have been avoided if, when their concerns were first brought up, that the pediatrician would just give appropriate referrals instead of trying to say, oh, this is not a thing. This is not a thing. There's a lot of research that backs pretty much everything that we do, the myofunctional therapy, the oral motor work, the ties, pretty much everything. The research is out there, but because it is not streamlined medicine, I would say, that most of our doctors are used to treating, they just completely dismiss it. And then I have families that come in and their poor child hasn't been able to talk for 7 years, and they've been in speech therapy for so long, 3 times a week for 5 years. I've heard all kinds of numbers. It's just insane, the things that I hear, and no change has happened. And the pediatrician just is like, well, they'll outgrow it, but it's kind
How
of
do
like,
you outgrow a tongue tie? I mean, you can't,
you
can
can't.
you?
It does, yeah. It's an anatomical attachment. It's not something you grow out of. Can you compensate and learn to work around it? Absolutely. We can learn how to improperly use all of the muscles and use them the wrong way for a long time. And then over time, that's where our severe TMJ people come from, because we're using muscles to do things we shouldn't be. We're chewing improperly. We're swallowing improperly. There's so many things that kind of snowball if we don't take charge and do something about it in the beginning.
That was actually my next question that I had just written down. What can happen? Like, what are the outcomes of this if it's not taken care of? What you said, TMJ.
Yeah.
I mean,
so I kind of like to name them by age. It's a little bit easier for people to digest if we're going
no pun intended.
chronologically. So infancy, obviously, one of the biggest is going to be our breastfeeding issues, right? So having our lactation issues, pain for mom, mastitis issues, not draining the breast, all of the things that come with the ties or oral dysfunction, gassiness, clicking on the breast, leaking of the milk from the mouth, swallowing air, excessive reflux like symptoms. There's a large majority of that population that it's either tie or oral function related. And after that, if we get through that and we learn how to compensate and all of a sudden that gets a little bit better, or you guys learn how to mask the symptoms, that's typically what's happening in infancy, is we're masking symptoms with probiotics or compounded reflux meds that aren't even FDA approved for infants. There's a lot of stuff that we can do that it seemingly gets better, but it's not truly getting better. So past that would be, we have issues with solids. We can't chew foods. We can't move them around. We can't do actual solid foods, not pureed foods. We gag, or we actually choke all the time, and we stay on pureed foods for a really long period of time, or pouches of foods. I see that a lot too. After that would be when we'd notice our speech issues, our mouth breathing issues, our snoring or apnea issues. At any age, doesn't matter what age you are, is not normal. It is common, not normal. So our society really normalizes a lot of these conditions, but it's not something that we actually have to live with. TMJ issues, pelvic floor issues can be related because of the deep front midline issues. Gosh, there's so many that can go with it.
What? I had no idea. And I'm a nurse midwife by
Yes.
training.
Yeah.
I had no idea.
Yep.
Wow.
Yep.
Okay. Whoa. Okay. Explain to me, what is the cheek tie? Because I've never heard that.
Yeah. So there are what we call frenums, and they are supposed to be there. They are points of attachment in different areas of the mouth. So we'll have one under here. Yep. Underneath our tongue, lower lip here. And then typically we'll have 2 here.
Yeah.
Cheeks, and then 2 up here on the cheeks.
Okay.
So when you pull out really, really far, you'll see that there is that point of attachment, just like the lip or under the tongue. And not all of them are bad. Just because there is that attachment there does not mean that we have to do something about it, but it depends on where it attaches. So if it attaches down towards like where the tooth is,
yeah,
person really can't move this muscle group. And as they get older, they're going to have lots of recession on their teeth. because of that pull from that fascia. Lip is kind of the same way. We need each group of muscles to do its own job. If they cannot move effectively and they cannot do what they're designed to do, we start recruiting muscle groups. So it's kind of like, Danny, if you and I worked in an office together and we have our own caseload, right? And for whatever reason, I'm restricted. I don't know why, but I say, hey, Danny, I know you're already overworked and you're really tired. You're doing your own job, but I need you to come over here and do my job too, in order for us to accomplish this. And then over time, that muscle group gets way overworked. And then that's when we start having the pulls and having the TMJ issues and having all of the other kind of snowball things that can happen older in life too. And sometimes younger. I have a lot of ortho relapse patients that they've been in braces 2 or 3 times by 18, and they continuously relapse, and it's because their muscles are not being changed. We're changing where bones are, but we're not changing their muscle function, and then things get pushed back the way that they were.
Unbelievable. And I wonder, I mean, I mean, it's not a fluke that people have tongue ties or cheek ties. I mean, but it's just a malformation. I mean, it just happens. Do we have any genetic? I mean, see, I don't know enough about it. Is there any genetic reason that kids would have this? I mean, does it run in families?
Yeah, so this is what we learn and what we kind of know about it now. Of course, any kind of research typically is going to have to be backed by somebody, and then it's going to have to be funded by somebody. So
Sure.
that's why there's less research for stuff like this versus
Yes.
stuff like, whatever else is out there that I'm not going to go into. But the stuff that we do have and that we do know is that there is a genetic factor to it. There's a component that, if it's running in the families, it's probably something that we need to look out for as children are coming and developing. Also environmental. I think that that's probably one of the biggest aspects of it. We hear a lot about, it kind of goes hand in hand with the MTHFR mutation. So you might be a little more likely to have the ties if you do know that runs in your family. But it's kind of we're still learning. We're still trying to figure out where this stuff is coming from. Is it the folic acid versus the folate in the people that do have the MTHFR SNP? I think a lot of it too is environmental. I mean, if you think about even if you live the best that you can, right? Even if you eliminate everything inside of your household and you just really try to be as clean as possible, you can't avoid Wi-Fi anymore. You can't avoid technology. You can't avoid exactly. You can't avoid cell phones that we all use all the time. You can't avoid what's going on in the air outside, what's being put in all of our food. There's a lot of stuff that you just can't control. And I personally feel like it is part of our de-evolution.
Wow.
I know.
Fascinating, isn't it?
Yeah. So as we do things a certain way for a long period of time, the body adapts. That's the change that happens. And so a lot of people will say, okay, well, why do we even get third molars if we never keep them? Okay, well, the idea is that we do keep them. They're there for a reason. And it keeps your jaw big enough so that we have a really nice airway so that we can breathe well, which is where Breathe Well group came from. That's where the name came from. We're breathing well. But we take them out. It's kind of like a rite of passage. You get to a certain age, we take the wisdom teeth out. We don't know if they were ever going to fit there because we never gave them the chance. We just take them out. And I've been hearing a lot of people are not even developing the buds for them anymore. So from us taking them out for so long, our bodies are adapting and we're not making them the way that we used to. So what that is going to do is it's going to create smaller and smaller jaws. And that is compromising our airway, our tongue resting up in the roof of our mouth and the chewing and developing the upper arch, lower arch. It's really this whole part of your face, your sinus cavities, your upper jaw, your lower jaw, how your ear canals are positioned. Are they like this? And do we hold fluid and get ear infections a lot? Or did they slant just a little bit so that we can drain the eustachian tubes the way that we need to? There's really a lot that comes from not using muscles properly and possibly having ties. I mean, it's a huge, life changing. It changes everything.
Well, apparently it does because we've got Lindsay says on here. She says this is exactly what has happened to my daughter: breathing improperly, alignment issues, sinus issues, speech issues, headaches, jaw, sleep, gastro intestinal issues. Literally had an ENT tell me they didn't believe that tongue ties and buccals were real buckles.
Yep.
This was after my 13-year-old had multiple tie releases with great results. 13. Lindsay, I am so sorry. Holy cow.
Yeah. It really is disheartening that we have so many practitioners that are out here saying, oh, that's not a thing. Oh, that's not a thing. Honestly, in my opinion, if somebody comes to me with something and I'm like, oh, no, that's not a thing, and then it turns out that's a thing, it kind of feels like a little bit of malpractice. Like we're
You
just
bet.
completely ignoring these things that people are coming to us with. And it really changes people's lives. And like Lindsay said, the GI issues, we see a lot too. That was one that I did leave off. But mouth breathing in particular, what mouth breathing does is it changes how this is forming. So if we're open, so mouth breathing can look on different scales. It can be like this, it can be a little bit, it can be slightly parted. You don't know, but air's coming in. It can be around a thumb or a pacifier, and they're still breathing that way, but you can't tell because there's something in the way. That's taking in unfiltered air. And then that unfiltered air is introducing bacteria into the throat and into the gut. So we can have a gut dysbiosis, even if you're doing everything right, trying to get gut under control, just from not breathing properly. And it feels like you're kind of swimming upstream and you've thrown everything at this gut dysbiosis that you possibly can, and you're not getting anywhere. Well, sometimes we need to look at how we're breathing and what we're taking in too.
My mind is blown as well. Oh, wait. Oh, Nancy, I was getting ready to show you here. Mind blown. Absolutely. I mean, and I'm not blown very often. Like I understand quite a bit, actually. Yeah, this is fascinating. This is why I love Chelsea and I were talking about this before we got on here. Such a niche. I mean, this is such a narrow down niche that honestly is not that narrow, but it is as well, right? Because I'm going to find out what the percentage is of people that are tongue tied. And yes, Nancy, we do have a sick care system. Absolutely. But
Yes.
Karen, what'd she say? Yep. Just learned at age 56. Karen, I'm tongue tied. And my 27-year-old is tongue tied and explains why she had
Yep.
such a hard time nursing.
Yep.
What? I wonder if my son is tongue tied. He had such a hard time. It was awful. He didn't latch on for 3 weeks, but now and then he finally did. He never had formula, supplement, all that.
Yeah.
But I mean, none of that matters. But
Yeah.
he's in medical school. I mean, it hasn't affected the way the kid talks, but I wonder, it'd be interesting to
Yeah.
find out.
After I started getting into this, obviously I went back to my mom and started asking questions, and we were never able to nurse. It was so bad. My mom said it was so painful, and I would cry all the time. I had colic all the time. Pretty much all of the symptoms that I would see in some of my infants that have ties are just oral muscle dysfunction that needs to be worked on. And I had a tie. I went through myofunctional therapy. I had my tie released. I had all of that stuff done in 2017, but she just didn't know. And, of course, all the information she got was, well, you can just go to bottles and formula, or, like whatever. You don't have to breastfeed. It's not a big deal. If these are the symptoms, we'll kind of get around it.
Yep.
But in addition to that, I had a lot of speaking issues. My tie was not all the way to the tip of my tongue, so it wasn't awfully awful, but it really inhibited a lot of my function. So I remember that you really could not understand me until I was almost 5. And I still, if I have to repeat myself a lot, I have a visceral response because my body remembers what it was like when I was trying to communicate at such a young age. And people just kept saying, what? I can't understand you. I can't understand you. Or just, like finally just ignoring it because they couldn't understand what I was saying. And to think that I could have avoided going through all of that, it's just really sad.
Yeah. And and I'm thinking about my daughter. My daughter latched on immediately, nursed like a rock star, but didn't speak forever. I mean, like I had to have her in speech therapy. I mean, it was crazy. And they said, oh, it's just because her brother's talking for her. He's only 19 months, older. But who knows? Maybe my kids are tongue tied. I don't think I am, but you never know. Look
Yeah.
at that, Emily. You were. I wonder, did they clip your tongue? And it's not a complicated procedure. Now, it can't be comfortable, right, for the baby. But when I worked for Dr. Kalb, I cannot tell you how many babies we clipped. I mean, bring them in there. I
Yeah.
mean, and they put them on that little board. I mean, like they did a circumcision with it, and they clip that tongue real fast. But I've never seen a cheek, or they do the same thing for cheeks.
Basically, so most of the providers that I send to do laser releases with a CO2 laser. So there are multiple
Oh,
types of lasers. The CO2 laser is a cold laser, and it basically vaporizes the
yeah,
tissue.
it sure
And we don't
does.
have any of like the burning, like anything with cauterization or a diode laser. So post-operatively, we have a lot less pain with that. But basically, you kind of point where the tight tissue is, and it just kind of disappears. And then it leaves a little bit of an incision area for the cheeks, but they're very minor compared to our lip and our tongue.
Fascinating. Julie, I didn't know this. My 8-year-old has all the things, was born with tongue tie, lip ties, which were revised, and she's MTHFR, but nursing was terrible. He has speech issues, mouth breather, etc. What does treatment look like for him? His new provider recommended you. So I'll be making an appointment soon, but I'm just curious, what does it look like? Yeah, Julie, that's a fantastic question. Girl.
Yeah. Yeah. So with that age population, our goal with myofunctional therapy is to do a complete neuromuscular re-education. So that's a fancy way of saying we're completely changing what the brain is telling the body to do with how we're positioning our tongue for speech, how we're eating, how we're drinking, our resting posture, how we're using all of the muscles in the oral cavity. So a program is really customized to the person, but it is typically we go through what we call an intensive phase. That's where we do a big bulk of what we're trying to change. So we meet about weekly for the first 8 sessions. And what we're doing is we are prescribing exercises that will target what we're trying to accomplish. You guys do those at home for homework for about a week. You come back, we retest them. And depending on what we're finding, we will either change, give a different variation, or we graduate you up to a harder exercise. And we work around all of the different muscles from here to here. So we're retraining pretty much everything that we would do with the whole oral cavity, head, and neck region.
Good Lord. Unbelievable. I'm blown away. I mean, I am. This is fantastic, man. I love learning new stuff. What would you say to someone who knows their child is tied but doesn't think it's important to address?
I would say that
Oh,
because
oh,
I have a lot of families that at all costs, they really want to avoid doing a surgical intervention.
right.
And as I said, I am not here to push people one way or the other. That is not my job as a provider. My job as a provider is to give information, give recommendations, and then if that's not what they want to do, then we do as much as we can with getting the muscles functioning. Um, and what I tell them is, we may have gotten through this hurdle of nursing or whatever it is, whatever phase of life that we're in, but this would be the next thing you need to look for. And if this is happening, then we know for a fact that those ties are really inhibiting how we're functioning and how we're living our everyday life. And we need to revisit the conversation about having the releases done.
Man, I
You
bet you
cannot,
see this often.
yeah.
One parent, yes, the other, no. Oh, yeah,
Yeah.
yeah.
And there's a lot of typically us as women, we're the ones that are information gatherers.
Yes.
So typically the moms will come into me and they know a lot of stuff already. They have done tons of research, lots of their own research, which is amazing. It's great. You can find lots of good information out there. And then the dads are kind of like, oh, I trust what you say, but I don't know about this. So that it always is that way. It's very rare that
Always.
dad that comes in and they're the one that's like really, really on board and the mom doesn't want to. But I just explain as much as I can what can happen if we don't. And every situation is a little bit different. So
Sure.
some are really severe and our dysfunction is really bad. And I know that this person, if we do not do something at this age, they will be one of my older clientele that we have severe dysfunction and issues. And I have that conversation. I say, this is where I see that we're on track for going, just so that you know, not that I'm saying you absolutely have to, but just be prepared that if you need to come back in the future, this is probably a conversation that we're going to have. And all of my clients have access to me, especially forever, basically. So even if somebody graduates with me, their portal is still there. They still have access to send me messages. They still have everything that we've talked about in the past, everything that I've given them. They have that support system there, because I feel like that is one big place that we're failing, is that we don't have the support system that we need to. And everything is nice and neat in our little client portal. We don't really do a lot of texting in our office because we like everything to stay in one place and to stay secure.
You bet.
That support is there. So if I say, hey, when they're 6 months, if we can't do solids, you need to come back, they know I'm going to send Chelsea this message because this is our red flag that she told us to look for, and it's happening.
Wow. Emily, it sounds like you could have had some serious intervention when you were younger, right? I'm so sorry that you went through all of this. She's the one that was tongue-tied. She had it released when she was 2.
Yeah.
Wow. Wow.
Yeah.
Isn't that something? Nancy says, this is interesting. The speech pathologist said that my son was almost tongue-tied. He also struggled with stuttering. I regretted not breastfeeding. My son has all the leaky gut issues. How are you almost tongue-tied?
You're not. That is more of they just didn't really know. So that would have been a situation that really the conversation should have been, honestly, that's not my area of expertise, but let me help you find a provider that is a specialist in this area.
That's right.
But
That's right.
it's kind of the same thing with pediatricians. They kind of say the same thing. Oh, I see a little tie. I'm like, I don't even know what that means. That is not even a clinical term. Like,
Well, you're either tied or you're not.
yeah,
I mean,
exactly. It's
yeah.
not, it's kind of like, oh, you've got a little limp. Like you have a limp or you don't have a limp. It's
Yeah,
like
that's right.
one or the other. There's there really isn't a mild tie. Like I hear that a lot. Oh, they said it was a mild tie. I'm like, okay, that's not a classification of a tie. I don't know where that information comes from. That is nothing. That doesn't mean anything. That's something that somebody made up because they didn't really know the answer, which is typically where a lot of these specialists, they, whether it be speech, whether it be, there's even Myo, there's lots of people. It's not one certain group, but they just don't have the knowledge. So instead of feeling like they don't know, they just say something.
Yes. Yes.
And I'm not that kind of provider. Will be the first person to say, I don't know, but I can ask this person, or I can send you to this person, and they're going to know the answer for you. Because of things.
That's what I do. I say, I don't know, but I know somebody who does. So here, let's go.
Yep,
yeah.
Absolutely.
Yeah, Candy. I guess the jaw can grow out of shape and posture can be effective to get air in through the airway that isn't effective. The head juts forward. Yeah, absolutely.
Mm-hmm. And that's where a lot of our grinding at night comes from too. So obstructive sleep apnea is a big thing that we work on in our adult population. And obstructive sleep apnea is one of the biggest things we can change by just toning the tissues in the airway. So toning the tongue, toning the soft palate, toning the oropharyngeal area, kind of toning all of that tissue that is causing that obstruction of the airway, which obstructive sleep apnea is directly related to that. That's one of the biggest things that we can see change if we have the proper treatment.
Wow.
Yeah.
Look, she's a speech language pathologist in schools. So important and so largely unknown. People do not know about myofunctional, which I do want you to explain exactly what that is.
Yeah, sure.
Apart from tongue and lip tie, can you discuss mouth breathing? Actually, she did. Sorry, Candy, I'm already late putting this up. It is devastating, and doctors don't understand. Mouth breathing is never healthy. Snoring is never healthy. I hear all this too. Candy.
Yeah.
Yeah. And
It's
she talked about that mouth breathing. I'm sure you heard it, even affecting the microbiome in the gut, which makes perfect sense.
yeah.
I'm blown away right now.
Yeah.
Yes, Lindsay, it would have saved your 14-year-old. I think I shared that issues, but I wanted to share this that Louise wrote up here. She was the very first comment here. Her daughter-in-law used you. Every professional told her surgery was not necessary. It was a nursing disaster. Isn't that something?
Yep.
Well, I'm glad I didn't know about her, Louise. I don't even know how the world we found out about her. Honestly, ah, I'm so thrilled though, because I don't see babies anymore, newborns, but I'll tell you what, I will shout from the mountaintops about you and your practice. And Emily says, I loved being in special ed because we got to do things that the normal children got probably didn't get to do, like Special Olympics and field trips. That's exactly right, Emily. That's right.
Yep.
Can you explain how tongue thrust may or may not be related? I have, oh heck, she shot down on me here. Where is it? I have TMJ breathing issues and I'm 56. I'm in braces because I apparently pushed my teeth out
Yes.
of place.
So this is kind of what I was talking about with the population where they have to go back into braces multiple times because the tongue or the muscles of the face are pushing the teeth back out of place. So a tongue thrust is typically indicative of either a tie or an airway issue. And so when you swallow, your tongue comes out of your airway and shoots forward. That's our thrust forward. For whatever reason that could be, whether that's the tie that's causing that muscle pattern to happen or that you're trying to open your airway. So I would say that if you're not already working with a trained myofunctional therapist, especially before you get out of braces, you need to go through a myofunctional program because if you don't, you are just going to relapse again.
What? Okay, explain myofunctional for
Yep.
these.
So myofunctional, let's break that down.
Yeah, I'm gonna break.
Myofunctional broken down is just muscle function therapy. So what the muscles of our tongue are doing. Our tongue is not one muscle, it is multiple muscles. It's a muscle group. Um, if there is ever a battle between muscle and bone, muscle will always win. So it seems opposite because muscle is not hard like bone is, but the amount of force that we're getting from swallow in particular is about 500 grams of pressure. And then think about how many times through the day you're swallowing, whether it's saliva, food, drinks, whatever it could be. And if your muscles are forcing forward or wherever they could be, not into the palate, because that's where we should be pushing, is into the palate, then we have our tongue thrust signs where our teeth move. We have our narrow palates because we're not pushing up to spread the jaw out the way that we need to. That kind of is like the basis of all of it, is getting the muscles functioning and then doing the tie releases when the muscles are ready for that.
Wow. Girl, I'm so grateful. I'm sorry your son went through this, but I am grateful. And aren't those the best providers? The wounded warriors, the wounded
I
providers, right? I
Yes.
got into what I do because of my autoimmune
I
and same thing.
Mhm.
Look here, Chelsea and Breathe Well have helped me as an adult with my sleep apnea, and I will forever be thankful. I'm 70 and my tongue was blocking my airway and causing me to wake up every hour. Thank you so much, Debbie Peterson. Well, look at you.
I love it. Love Debbie too.
This
So
is
sweet.
incredible to me. So 70-year-olds.
Oh, yeah. Yeah, we've had, I think our oldest was probably about 76. And she came to us because dental hygienist had done a course, like in just a CE course on ties. And she noted that there was a possible tie. And that was basically it. And she was like, I'm not the expert in this. So I'm going to send you here and they're going to let you know everything that needs to be done and let you know for sure if it's a tie or not. And then when we found the tie, she said, you know what? My mom went into a nursing home and she got to a point where she could not use her oral muscles and she couldn't eat anymore. And that is not what I want for my life. I want,
No.
even if I have to go into a nursing home and I have to do whatever it is when I get older, I want to be able to eat and I don't want to go through what my mom went through. And that's a big thing. If we see it early on in life, they can't eat because they're not functioning properly. And then we learn to compensate and we can, that person is going to go back to not being able to eat when they get to an older age where their muscles are not able to compensate the way that they were.
Dang.
So it's not just breastfeeding. It's not just eating or speech when we're young or development, which obviously is a huge thing. It is this lifelong thing that we have to take into consideration. Just like I think it maybe was Candy that said it, but pulling forward, whoever was
Yes.
saying that about pulling
Yes.
forward, that is so much pressure on the rest of our body. And if we cannot get our breathing under control and can't get our muscles functioning, mouth breathing, we get about 50% less oxygen. So if you're getting less oxygen through the body, how can we heal chronic diseases if our body isn't able to go into a full restorative sleep state?
That's exactly right.
It's impossible. You can't do it. There is so much that comes from not functioning properly, having ties present, or just having oral dysfunction. Sometimes it's not ties. It gets blamed on ties a lot, and it's okay because a lot of people will get to us because of the tie word, but it's not always what it is. Sometimes it's just how our muscles are functioning.
This is mind blowing to me. I'm not often mind blown, but I am today. Nancy, I too would love to see sleep apnea companies just poof away, right?
Yep.
Due to no longer being necessary. I agree. Man, we have so many comments. I don't think I've had this many comments, and I can't tell you how long. Candy, thank you so much for sharing. Yes,
Yeah.
I agree. Lindsay says, my daughter's orthodontist is the one who diagnosed her and sent her to a special dentist. He said she wouldn't put braces on until we had approval from the myofacial
That is
therapist.
amazing.
Oh,
I love that. That is so amazing.
wow.
If we could get all of those specialties that, like I said, like we have a rite of passage, like our wisdom teeth come out at a certain age, it's a rite of passage. We go through braces at a certain age, it's a rite of passage, right? If we could get those providers on board, then we could really get to the root cause of all of these things so much earlier.
Well, I'm on board, but I'm not seeing new babies, but I'll shout it from the mountaintops. I used to see babies, but not anymore.
But as you saw with Debbie, we can really change people's lives at any age.
Yeah, absolutely. What is she saying? The Mayo something is not known. Knowledge is not widely out there, and it's looked at as pseudoscience. Well, everything I do is looked at as pseudoscience, so I fit right in here. I have referred families for further interventions, and they are told myofunctional therapy isn't helpful. There are very few myofunctional trained therapists. SLPs are rarely trained in this area.
Yeah.
Wow.
And that kind of goes back to when we have research, it has to be funded. And when we're getting the funding, most of the time, you'll notice that typically our research is going to go toward our Western medicine practices. Like it's not going to be the functional aspect, because when we fix people, it doesn't make money. Why would we fix them?
That's exactly right.
So it makes it hard because it becomes this battle of, I don't have the money to fund a worldwide study to see what percentage of people truly have ties and who are affected and what is causing it to happen. I can't do that. I'm not in this business to be rich. I'm in this business because I'm truly passionate and I love what I do. And that all I can do is stuff like this, getting my name out there and getting the practice out there and letting people know what we can do. And then actually showing people the results when they come to us. And I've had so many people that they, at the end, when they graduate from us, they're like, you told me that this was going to happen. And it's not that I don't believe you, but I'm just so shocked that these are the results that we got.
Isn't that something?
Yeah.
Wow. I tell you what, okay, is there anything else that we need to discuss that you need to get out there to the people?
I feel like I've covered a lot of it. There is also so much information out there. So if you don't have people in your area, of course, I don't know where everybody is in their areas. There are certain entities that you can look for trainings. And then what I do is I'll find a provider, say I'm looking for somebody in Alabama. I'll
Okay.
look through the AOMT, which is the Academy of Orofacial Myofunctional Therapy, and look on their provider list for people who have gone through their training. And then from there, I'll look the provider up, look at their website, and look through their training to see, okay, how much training does this person actually have? Are they qualified to do this? Because the bad thing about myofunctional therapy is that there is no overseeing board for it right now unless you're certified through a certain group. So the AOMT is one of the certifying groups that has a board that will certify you, but it's not overseen like speech language pathology or hygiene or nurse practitioner, whatever it is. The board is not the same.
Really?
So yeah, so unfortunately, people can go to a 2-day course that's an intro course and really not learn that much at all, but they can say, oh, I can do myofunctional therapy. Well, that's a problem because they don't know what they're doing and they don't really know much about anything. But people who come to see them don't know the difference between a good provider and a bad provider.
That's
So
right.
they go through it and they think they're getting what they need when in reality they're not. And then that person still has all these issues. So I would look up AOMT, kind of look for providers that have the training, and then continue to do research to see how much training they have and what age groups they work with,
Right.
and kind of go from there, because it's hard to find providers that do what we do because it's all additional specialty training. So almost all of us that you find that do something like this, like you said, are the wounded warrior providers. We've all gone through it in some aspect, whether it's our kids or ourselves. And some people do it just to get the CE credits. That doesn't mean they're qualified because they haven't done everything that they need to. So doing research on your providers is super important when you're looking for somebody who you can collaborate with.
Amen to that. Amen to that. I think that's a good way to almost end it here. But let's see. Lindsay has something else to say. I'm fascinated, Lindsay. You've been through all this. My daughter's eye doctor said that the cheek buccals,
It
buckle.
depends on what area of the US you
I
live
know.
in. They're both the same. They're both right. It's
Yeah.
buckle here.
Okay, buckle. That's what I said. Okay. We're definitely contributing to her convergence disorder. Wow. A year post release and therapy, her convergence has lessened significantly.
Yeah. So let's go into that quick right before we end. So ties are fascia. They're fascial attachments. And fascia is like the spider webs that are like 3D through the body, right? Kind of like the easiest way to picture it, that is not like perfectly correct, but it gives somebody kind of a visual, is on a chicken breast. If you pull back that really thin layer of the fascia that's on there, not the tendon part, but the other part, that is surrounding all of our muscles and bones in our body. And like I said, that's not a perfect example, but it is close enough to kind of give you a visual. When we have those fascial pulls in different areas, we can have stuff like that happen. We can walk with a limp. We can drag our leg. We can have knee pain. We can have this, that. There's so much that comes with that. And I fully agree with the buckles, even lips, even tongues being able to cause things like that to happen.
My word. Ladies, we've already spent 50 minutes. It's all ladies tonight. Well, all ladies that are commenting. I don't know how many people. Listen, I want every single one of you to share this on your page, on your Facebook page, on wherever you have. I want you to share it, because I'm just telling you, we've got enough stress in this world. And I mean, this is not one thing that needs to be added to it. And the fact you have lactation consultant in there, and she's all over the place. So tell them some of the areas you have an office in.
Yeah. So my biggest goal is having access to care in multiple places. And because of that, what I choose to do is sublet from other providers so that I can have office space in different cities. So I have a Franklin location, Mount Juliet, Murfreesboro, and West Tennessee. And then sometimes I have a provider in Chattanooga that will have me come out there, once a month or once every couple of months when they need access to care too. And I'll travel to their office and just see a day's worth of people. But the other 4 are standing offices that are always being ran all the time.
Fantastic. I think that is a brilliant way to do it. I mean, so go on her website, it's the Breathe Well, right? TheBreatheWellGroup.com. There's the email and there's also the phone. Is that the phone number? Because that's what I got offline. Okay.
Yep, that's our
All right.
office number.
And check her out and share it. Emily's already shared it. So Chelsea, I appreciate you so much. You're doing amazing work. And if you ever, when you're here in Franklin, stop by the office one day and say hi. Come to the supplement store.
Yeah.
And say hi to us. I would love to meet you in person. So this is why I love what I do, people. I am a firm believer that a rising tide lifts all boats, and you have to promote other women and other men as well, but other businesses. I mean, we can't do this all ourselves. I don't have any idea how she does this job. And she couldn't do my job. And I mean, I'm just a big believer. We have to learn about so many different things and we have to support each other. She's a woman mom over here, running a business. And I'm so proud of you because you are changing people's lives. You're changing families' lives. And not only that, Chelsea, you are changing the whole trajectory of generations. That is fascinating. That is overwhelming. Like that makes me cry.
Yeah, that is my goal. It is my passion that I am going to, even on a small scale, even if it's just in Middle Tennessee, I'm going to change the way that we treat people. It will not be this place where we had to give up breastfeeding because we couldn't find the support or whatever it could be. My life's goal is that we are going to change that.
And you're doing it one tongue at a time, one cheek at a time, one family at a time. You are changing. You're changing the world. So I'm very proud of you. There will not be any Sunday night service next Sunday night because Jackson, all my family, everybody's going, well, except for my mom and my ex-father-in-law, my ex-husband and I, we're all going to be in East Tennessee for Jackson's white coat ceremony from medical school. Yeah. So he's getting his white coat. All the second years you get your white coat. So I'm going to be up there all weekend with my ex-husband, which I've spent no time with in 20 years, really. East Tennessee, as far east as you can go. Guns, because Jackson loves guns. So I'm sure they'll be shooting, and so alcohol, I suppose, because I know my ex-husband. So there you go. Alcohol, East Tennessee, guns, in-laws. I mean, you name it. What could go wrong? What could go wrong next weekend? I mean, what could go wrong? And we're in the middle of East Tennessee. So good Lord. So anyway, no Sunday night service, but the next week, and I think that's May the 6th, but I'm not sure, Dr. Jill Carnahan. Holy cow. She is unbelievable. She just has a book came out a couple of weeks ago, Unexpected, Finding Resilience Through Functional Medicine, Science, and Faith. And we're going to be talking about her new book. And she had very aggressive breast cancer, double breast cancer at age 25 in medical school. And now she's my age. But anyway, she's written an amazing book. So, yes, we are proud. We are all proud over here. Yes, we are. It's going to be a ton of fun. And you know what? I've rented a big old house. Everybody's staying there except my ex-husband. I mean, I just didn't think that. I thought his wife was coming. So, and she's not, which that's fine too. But so he's staying in a hotel. But I invited him for Friday, Saturday, and Sunday to come because I'm doing the right thing, and it'll be fun. And you know what? I've been divorced 20 years, Chelsea. You don't know this, but 20 years single. We're there to celebrate one thing, Jackson
Absolutely.
and his class. And so I've already told my dad, I've told everybody, be nice. Everybody be nice. Let's just celebrate this kid and the accomplishments. So that's that. Chelsea, I appreciate you. Thank you. Thank you for taking an hour out teaching us about tongue ties and myofascial functional myofunctional
Myofunctional. Myofunctional therapy.
I
Yeah.
sound like I've been drinking. I'm drinking vitamin C water here because I feel like I've got allergies. I'm not drinking, I swear. All right, guys, have a good Sunday night. Thank you for supporting local, support local, shop local, go to your local bookstore, go to your local supplement stores, just shop local, guys, and support small businesses because, it's where we are. Appreciate you, sis. Have a good one.